Okay. Hi, everyone. My name is Nare, and I'm from Team oDoc. Welcome to another oDoc webinar. Before we begin, I would first like to say I hope everyone is staying safe and at home. It looks like we're well on our way into our fourth wave, and the onus is on us to keep our loved ones safe. The only way out of this is via the vaccines, so please do get vaccinated. If you are experiencing even mild COVID symptoms, please err on the side of caution and speak to a doctor via oDoc and get accurate medical advice. If you are home quarantining and need medical assistance, our oDoc Home Care package gives you access to a dedicated doctor who will virtually monitor your symptoms daily. Okay, back to the webinar. Part of the problem with the pandemic is that it leads us to neglect other diseases, either out of fear of going to hospitals or to see doctors, or due to an overburdened medical system fighting a virus. In the past few weeks, we have got a lot of queries on cardiac health, and today we'll be discussing everything related to a healthy heart, from high blood pressure to the difference between a heart attack and cardiac arrest, to congenital heart disease. We'll also be touching on preventative care for a healthy heart. To discuss all these and more in detail today, we have Dr. Sampath Withanawasam with us. Dr. Sampath obtained his MBBS and MD from the Faculty of Medicine at the University of Rona. He then pursued his MRCP in London, UK. Having over 14 years of experience in cardiology, Dr. Sampath is currently a consultant, clinical and interventional cardiologist at the National Hospital of Sri Lanka. Welcome, Dr. Sampath. It is a great pleasure and honor to have you with us today. Thank you for taking the time out of your busy schedule to answer some of our questions. Before I jump into the questions I have, I would like to remind the viewers that if they have any questions they would like to ask Dr. Sampath, please send them to us via the comment section or DM us. Okay, so first question, starting off talking about risk factors related to heart disease. Is it true that hypertension or high blood pressure is probably the most common factor? If so, what must someone do to control their blood pressure and maintain it at an optimum level? And what are the other risk factors that you would associate with heart disease?
Yeah, Naren, I will start from the second question that you raised, actually, the risk factors that we have. Now, say for easiness, that we can divide it to risk factors to two categories. One thing, the risk factors that we are in our control. The other thing is beyond our control. The things that beyond our control is no point of talking quite a lot, but it's better to know the things. Actually, the male sex is a risk factor, age is a risk factor for anybody, as you are aware, and the genes, that is what you are getting from your family, the parents. Those three are actually is a age and the family history are very big risk factors, is contributing quite a lot. But unfortunately, we didn't have a say on it. We can't control those things. It's beyond our control. Only thing that I wanted to highlight on that risk factors, if you have those things, you should have extra care. Say, for example, if your brothers, sisters, parents has got heart problems, you know that it could be you could be the next one. So then you should be, it's an alarming sign. And everybody, when you are getting older, you should be careful. And the male sex. And actually, what we say, if you compare the age, the male risk is 10 years more than the female. So, for example, if you take 45-year male, and his risk is equal to 55-year-old female. So roughly 10-year gap when the balance with the age. Okay, so those are these three. And the other main risk factors that with the common risk factors, actually the main four, one is high blood pressure, I would say the commonest, and which we are going to talk in minutes time. And then the high sugar in the blood, that is diabetes. And the third is high cholesterol in the blood. We call it dyslipidemia. And the fourth is unfortunately smoking. So those are the commonest the risk factors. But there are some evolving risk factors, especially with the modern, our lifestyle. Out of that, the stress is a big risk factor. not only the stress, sometimes your workplace environment, family environment, and your mood swings, and all these things can affect the heart in a way. And lack of exercise again is a huge problem these days. You know that especially the kids and even the other people afraid of going out of the home, and they are not going to the gym, not going to the track, and all those things affect actually. Having said that, we'll come to the hypertension. This is your first question. I would say hypertension, as you correctly mentioned, is the most prevalent risk factor. And some people introduce hypertension as the silent killer, and it's like a ticking time bomb because it's so bad. And somewhere around 20% of the population in some countries, close to the 30% of the population are affected by high blood pressure. The worst thing is only 10% out of this. Now, if you take this 30%, 1/3 of that 30% even didn't aware that they have high blood pressure. It's a hidden thing, right? Unless you check it, you don't know. And 1/3 out of these 30% is not properly controlled high blood pressure. Even though they are taking tablets, their pressures are not under control, not on the optimum level. And the other 1/3 only that control. So you can imagine how bad is this. And if you just give me 1 minute, not only the heart is affected by high blood pressure.
Right.
If you take the stroke either is a ischemic, so that means if there is a bleeding inside the brain or a blood clot inside the brain. Those are the two pathologies, the underlying causes for strokes. And whatever the reason, the hypertension is the main culprit. If you take heart attacks, one of the main culprit is hypertension. If you take blindness and the eye problem, one of the main thing is the hypertension. If you take kidney disease, one of the commonest thing is hypertension. If you take dementia, say the senile, your memory capacity impairment, one of the main reason is hypertension. If you take the peripheral vascular disease, not in the heart, in your legs and the other things, then again, hypertension plays a major role. So that's why we are telling hypertension control is actually one should take care of your blood pressure, and it's a real killer. That's why I told you it's a silent killing disease. The most important other thing with regard to the hypertension, it doesn't give you any alarm until it comes to a later stage. Unless you check it, you never know that you have hypertension. Even though we said sometimes headache comes, it's in a late stage. Most of the headaches, that actually what happened really, you get a headache for some other reason, you come to a doctor and check the blood pressure, and incidentally you know that you got to know that you have high blood pressure. Not that blood pressure causes headache. The headache is a very late sign of hypertension, when your blood pressures are about 200. Likewise, it's usually with the mild form of or moderate form of hypertension, the headache is not a symptom. What is usually people are misunderstood, that is a coincidence. Just a headache comes with some other reason, but you go and check, it's so prevalent, and you found that you are a hypertensive.
So doctor, in that sense, does it make sense? So a lot of people have blood pressure monitors at home, right? So sometimes how's the best way to check for hypertension at home? So is it just a one-off check, or should you be checking at the same time for a number of days? What's the best way for someone to realize that this might be a problem for themselves?
Yeah, I think best thing is to check once in a way if you are about 30, right? And if your blood pressure is normal, and I don't think that you need to worry, and check it daily. And again, it's not a good thing because it's really disturb you. And if your blood pressure normal and you are quite young, doesn't have any other problem, I would say even you are checking blood pressure next year would be fine, because it's not a disease that comes in overnight or 1 month or 2 months. So you check it next year, that's fine. But if your blood pressure is high, then of course you have to check for a couple of days, because blood pressure in a person is not a static thing. It goes up, goes down, and depending on your mood, depending your whether you have any other problems and your excitement and day and night variation, is not a static thing. So if you found that your blood pressures are high, best thing is to recheck it. Maybe same day afternoon or next day, and the following. You can get some day, couple of days, 3 days, 4 days continuously, mark it and take it to your doctor. That will be helpful. But if your blood pressure found to be normal, I don't think that you need to worry, and checking for every fortnight or every month is really a hassle.
Yeah, it becomes a mental health issue then, right?
Yeah, definitely.
And doctor, is there any other early signs that someone could keep an eye out for that indicates their heart is at risk, other than perhaps checking blood pressure? Are there any early signs?
Yeah, those are the things that we were talking about, risk factors.
Yeah. Okay. Okay. So if I just move on ever so slightly into what happens, after you've become hypertensive, or your age has come into, or your genes have come into fruition. Looking at heart attacks and cardiac arrest, are those two the same thing? Is there a difference between them? And if so, what? And I think most importantly, doctor, if someone is having a heart attack in front of you or a cardiac arrest in front of you, how can you help that person until emergency services can arrive at the scene?
Right. I think one of the wonderful questions that you raised, but it's a huge question, is okay, fine. So the one thing for even for quite educated people, heart attack and cardiac arrest is almost same. Like same thing happens if you take bypass surgery and valve surgery. For most of the people, it looks same, but huge difference. Now here again, yes, heart attack is a completely different thing from the cardiac arrest. I would try to explain this in a simple way for you to understand. We'll see whether I can do it quite reasonable way. Right. First, I would say I would discuss about heart attack. Okay. Heart attack. Heart attack, the medical term that we call is myocardial infarction, right? And sometimes you might see in the diagnosis cards, it in short form will say capital M, capital I, MI. So myocardial infarction, that is the medical term for heart attack. So the heart attack is now, unfortunately, I just want to tell you this bit also. You know that the heart is the blood pumping organ to the body. The inside the heart is a cavity, and this cavity is always filled by blood right throughout your life. But unfortunately, the heart can't utilize that blood.
Right.
The heart can't utilize the blood inside the heart. That is, I don't know why that God did that in that way. Yeah. It has to pump outside.
Right.
And from that pump, there are another blood vessels, and then it again has to supply outside, from the outside to the outside of the heart muscle. And that blood only that the heart can utilize. That blood vessels are tiny blood vessels, right? One coming from the left side, which divided two main branch, and one is from the right side. Of course, that is the first two blood vessels, which comes from the aorta. Aorta is the main blood vessel which supplies blood to everywhere of the body, which goes out of the heart. And in the aorta, the first two blood vessels, one come from the far right, the other come from the left, which we call coronary arteries, and those are supplying the heart. And any reason, if you get blocked these blood vessels, right, the part of the heart, that is part of the heart muscle, which supplied by that blood vessel is not getting enough blood to survive. Right? And the commonest cause, 99% of the time, this is because of cholesterol deposition inside these coronary arteries, and which is the cause for blocking actually. And there are very rarely, there may be other causes which I don't want to highlight in this forum because it takes quite a lot of time. But the main reason, 99% or even more than that, is a cholesterol deposition inside the blood vessels. And actually, this cholesterol deposition starts from your childhood. Say somewhere in your first decade, 7, 8 years of your age. So that's why we are always telling, for you to stop heart attack, you have to start at early stage from Montessori life, not in when you are 30s and 40s. And depending on the risk factors, I think you are correctly asked the risk factors at the beginning. Depending on your risk factor level, this cholesterol deposition rate is different from you and me and some other person. For some person, is very slowly deposit inside the coronaries, and until he dies in 90s, nothing much has happened. He is a lucky person who doesn't have risk factors. But if you have a single risk factor, the deposition rate of cholesterol inside the coronary artery is slightly higher. If you have two risk factors, higher than that, 3 risk factors, more than that, 4 risk factors. So accumulating risk factors means your risk for getting heart attack is high. The simple theory is if you're accumulating more risk factors, you're getting accumulated more cholesterol in your blood vessels. Right. Then one symptom that you get when you walk or when you doing something or when you get emotionally upset, your heart rate kicks up. You will see that your heart is but simple word, the medical word is palpitation. Your heart is beating in a higher rate. When your heart is beating higher rate, that needs more blood to the heart, right?
Right.
Because just like a engine, when you raise the engine, that consumes more petrol. Likewise, when your heart is raised, you need more blood to get that heart to work. So when that happens, if your blood vessels are narrowed, at that time, the blood supply to the heart is compromised. But when you are resting, you are calm, you can do anything. But when you are trusting, when you are exerting, when you are emotionally upset, when the heart rate goes up, then the blood supply is not enough. Then you are feeling uncomfortable. And again, I want to highlight, this is something extra, but I want to highlight this thing because it's one of the main things everybody should know. The heart is an internal organ. Is an internal organ. The heart is supplied by the different nervous system from the nervous system that we get the nerves to our skin. Say, for example, for you to get this very clearly, if you get your thumb injured in the left side and you don't get the pain in the right side, so that pain is precise. But when it comes to the heart or any other internal organ, the pain or discomfort that you feel is not precise. So because of the same reason, the most of the people think that the chest pain or a discomfort should come in the left side of the heart, which radiates to the left arm. But that is actually only for the minority. That symptoms you get only the 20% of the people. And 80% of the people will not feel a symptom like that. And most now, what I would say, from the jawline below, including the nape and above the umbilicus, right? Including the both arm, front and the back, you can get the heart pain. So it's a very, I will tell you again, from the jawline below, including the neck, right? Yeah. Above the umbilicus, front and back, yeah, including the both arms, you can get the heart pain, right?
It's a large
large area. That is because that nerve supply is not precise.
Okay.
Because the heart, the nerves, because these systems are made for some reason, and the heart nerve supply is mainly to raise your heart rate, slow your heart rate, increase your blood supply. It's not to feel the pump, the pain. Pain right. is for our skin, right? Yeah. This because of this, it's not precise, and I have seen majority of the people, especially because of this, you get the pain in the epigastrium exactly similar to the gastritis, and hundreds of patients are misleading this system pain as gastritis, and even sometimes they are getting killed themselves by taking the home treatment and staying at home. And this is one of the things I want to tell. You don't expect that you get to pain. Some people only explain, say, thirsty like feeling on the throat when you exhale. Some people say jaw pain, some people say shoulder pain, some people say epigastric pain, some people say interscapular behind the chest, the pain, and some people say chest pain also. But this could vary. This is something extra because I want to give that message, because hundreds of people are going to be misled by this unusual heart symptoms, since they are expecting left side of the heart should be get affected with the heart attack, nothing like that. But I was telling the coronary arteries, I said when you exert or the heart rate increases, the blood supply is not enough, and at that time heart is struggling. That struggle you feel as a discomfort or pain anywhere, right? Now this is actually alarming sign. When you are walking, when you are doing, is because at rest you are fine. That means at rest the blood supply enough. This block is not complete block. This is somewhere around 60%, 70% block of the coronary artery. What happened? The cholesterol layer or cholesterol deposition sometimes suddenly disrupted by some reason, right? It could be sometimes emotion, it could be nothing sometimes, but it eroded. When you eroded that cholesterol plaque at that place, as a body's mechanism, within the coronary artery, the body built a blood clot. That blood clot 100% blocked the blood flow.
Right.
So that is the reason for heart attack. And if you get, I think you are clear with what I'm saying.
Yeah, definitely.
The initial sign you get when you are scolding for someone, you are excited, you are emotionally problem, or when you are exert, your heart rate goes up. When your heart rate goes up, you need more blood to the heart. When that cannot be supplied because of the block, and you get discomfort, that is not a heart attack, it's an alarm.
Right.
That you have a significant block in your coronaries. And suddenly that 60% or 70% block going to be 100% by a blood clot. It is not the reason for cholesterol deposition. Cholesterol deposition takes years and years. That doesn't happen suddenly. The sudden change is the blood clot on the cholesterol plaque, right? Which causes the heart attack. And the most important thing, again, these two are very important. I wanted to tell you. The most important thing, once your blood supply cut off for the heart muscle, the heart muscle can lie for about 30 to 40 minutes.
Okay.
Just imagine if you take a fish out of the water, the fish will not die immediately. Will stay for a couple of, depending on the fish, depending on some minutes without dying. And after that, if you put them to the water again, and they will swim again. So the same scenario here, once the blood supply cut off completely, when it cut off completely, heart muscle will survive for about 30-40 minutes. 30-40 minutes, right?
Okay.
And thereafter, it start to die one by one, right? Okay. So this process is going to complete in majority of the people by 6 hours.
Okay.
Right?
Right.
The mostly 80% of the people, it will be in 6 hours. Almost 99%, it will be complete by 12 hours.
Okay.
Right? Okay. Now, the treatment for heart attack, I would say this one also, you have to open the artery, but no point of opening the artery once your heart muscle is dead.
Right.
You have to open the artery before your heart muscle is alive. So for that, you have to come to the hospital within 1 hour of the onset of chest pain, at least within 6 hours. Say if you come to the hospital after 12 hours, what can we do as doctors? Nowhere in the world, until you die, that muscle cannot be repaired. That death is permanent. Nowhere in the world we have treatment. Right? So most important thing, when you get a heart attack, identification is very important. That's why I told the previous symptoms, and then come to the hospital as quickly as possible. Earlier the better. If you can come within 1 hour, if we open the artery, chance the open artery within 1 hour, you go home as a perfect person without having a significant damage. And most of the worst thing, most of the people think now that chest pain or whatever the discomfort that we discussed comes and stay off a couple of hours, and then it gradually reduces and it's wane off and disappear, irrespective of whether you get the treatment or not. But most of the people doesn't know that pain disappears because heart muscle is no more viable to send you any sensation of pain. It's almost died.
Right.
Once you died, no pain.
Yeah.
That is how for most of the people pain goes off.
Okay.
Not because your heart muscle is cured.
Right.
Okay. So the first message, as general, government spending lot of facilities are in the private sector. We have a lot of doctors. All the people should know how to identify at least how to suspect a heart problem. The second thing, once you suspect the heart problem, please, God's sake, don't stay at home. Don't channel your doctor and wait till he comes the evening. Don't go for video calling or any other thing. Don't try paracetamol. Don't go and sleep and see whether it disappears. These are the common things that most of the people are doing. Don't drink Kothamalli. Don't drink antacid, that gastritis treatment, and wait. Please go to the closest hospital where ECG facility is available.
Right.
Right? So once the ECG take, the doctors can say whether this is a heart attack, this is gastritis, this is back pain, this is jaw pain. That doctor will decide.
Yeah.
Right? Because I'm telling this because time is so important. And if you really get a heart attack and if you misdiagnose as a gastritis and stay at home, and if you come to the hospital next day and you diagnose heart attack, we can't do anything. Only thing we can do is we can prevent complication of it, but we can't give a new birth to that dead muscle. Okay, so this is what heart attack.
Right.
This is a heart attack. Right. Okay. Now I'm going to say what is cardiac arrest.
Yeah.
Okay. Okay. Cardiac arrest is now the heart is a wonderful, very complex organ. Now, one structure is, as we already told, the coronary arteries in Sinhalese is Kiritaka Dhamani.
Okay.
In Sinhalese Kiritaka Dhamani. So that is the cause for heart attack. And the heart has its own wiring inside. Just like we have wiring inside our homes, there is a wiring. And through this wiring, there are small electrical impulses goes and which gives the commands. Say like when we on a switch, the light is on. And when we off the switch, light is off. Likewise, that small impulses use the heart to command to now contract, now relax, now contract, now relax. And the rate, everything that the small wiring does do the job. So that is called conduction system of the heart. It's a special tissue. And actually that's what I was telling. This is the one that gives impulses to the control the heart rate, right? And there are certain situations, abnormal situations, this the heart conduction system fail. Either way, either it gives impulses so rapid and very rapid, and it's to so much so that it's so rapid that there is no time to get the blood filled to the heart or pump to the heart. It's so rapid.
Right.
No time blood come to the heart and no time blood eject from the heart. It's so rapid. Or in the other instances, it's too slow and there is no effective blood coming or ejecting blood. It's either way it fails. It's because of this conducting system problem. And that failure, because of that failure, usually there are different names called depending on the way that it happens. But whatever that happens is basically a malfunction of the conduction system. Is a cardiac arrest is a problem with the electrical activity of the heart. The heart attack is a problem with the blood supply of the heart. And the cardiac arrest happens due to problem in the coronary arteries. The heart cardiac arrest is due to the conduction system or small nervous system which gives impulses in the heart, right? And the treatment, as I told you, the most important two message in terms of cardiac arrest, heart attack, you should diagnose it early, you should come to the hospital early, and we can open it.
Right.
We can open it.
Yeah.
Right? And either way of giving you a blood clot dissolving medication, and most of the hospitals available, that medication is available in the most of the hospital, that is effective somewhere around 60% of the time. And if we have facilities for catheterization, that you put in the balloon and crush the clot, and it is 99% of the time it is effective. So the treatment of choice is actually balloon crushing, which we call angioplasty and stenting, but that facility is not available everywhere easily because it's available. If you take Sri Lanka, Colombo, it's available, Kandy, Galle, Jaffna, and it's very limited. But this time is most important thing is, but blood clotting dissolving tablet is dissolving medication is also available everywhere in the country. So you should at least get that treatment, and then depending on the situation, the doctors will refer to a theater if you really need crushing of the clot by a balloon. If it first treatment is not successful, if you can't reach for the balloon treatment for the first time, so that is totally acceptable even in the developed countries. And the cardiac arrest is the treatment is to resuscitation of the heart. So you have to restart the heart. Now the heart is not functioning, we have to restart the heart. That has to be done by if it is happening in the outside, we call it cardiopulmonary resuscitation. That the pushing the chest compression, actually that again a responsibility of responsible individuals to learn about this, and YouTube videos and everything is there, because somebody arrested or somebody get arrest in front of you, and then at least cardiac compression without anything else will be able to keep him survive until he goes to the hospital. And that will be very effective, especially if you do it quickly, because if you start it late and that you don't have much of the time in a heart, even now I said somewhere around 6 hours, 1 hour or 2 6 hours that we have in terms of in case of heart attack. But here, if you elapse 10-15 minutes, your brain will be damaged permanently, and then no point whether you resuscitated that person or not, he will be a vegetable after resuscitation. So no point. So it has to be started immediately. And if you start immediately, that will be effective. Actually, what we have to do is, as quickly as possible, the electrical impulse that delivered to the heart, which we call defibrillator. In developed countries, even in the common areas, that they have defibrillators, and most of the people are aware how to use it. And those are automated. Once you take the pedal, the automated defibrillator gives you instruction what to do. So you don't want 100% aware of it. Even non-medical person can do those things. But our country, we don't see still outside the hospital. But until you get into the hospital or until you get into the ambulance, they have in the ambulances, the other people should be able to go for chest compression, at least if you can't go for breathing. And usually the rate is for 30 chest compression, you have to give 2 big breaths to the patient, and then again take 30 compressions, then again it's a cycle until you get the support. So that is the treatment for cardiac arrest, right? So I think it may be clear it's a completely two different things.
Fantastic answer, doctor. Thank you so much. Would you have a little bit of time for one more question? I know we've kept you for half an hour.
No problem, it's fine.
Okay, thank you.
Fine.
So I feel like a natural, great third question would be cardiac screening, right? So you don't want to wait till the last minute and have to experience any of these things. So say, what is the best frequency of getting cardiac screening? What should people be asking for? How often should people come and see a cardiologist and go for ECGs, exercise ECGs, etc.? What is your advice on that, doctor?
Yeah, actually, it's again a very important question. Now, say once you are more than 20-25 years, right, it's worthwhile checking blood sugar and a lipid profile, and if at all ECG, just as a baseline. If not, it's abnormal, it's your baseline. It's always better to know what your baseline is, right? And once you get, if it is normal in that stage, you can check your cholesterol in 3 years. I would prefer blood sugar again 2-3 years, because these things are not developing overnight. If you are in 20s and 30s, you don't want to check this every 3 months. Some people I'm seeing people are checking blood sugar every 3 months, cholesterol every 3 months, right? You don't want to do that, right? It's just waste of money. So check it for your baseline. If it is normal, 2 to 3 years time, right? But if it is marginal or high, then you have to go to your doctor. And say for your cholesterol levels are high, and then you need to take treatment, and the treatment is guided by a lot of parameters depending on his risk. Actually, we are lowering their cholesterol, but for that they have to go to the doctor and get the advice from them. Then they will decide how frequently that they need to do cholesterol. And even the patient who comes to me, sometimes every visit that they are coming, they are bringing cholesterol. I'm asking, why do you do that? Because it's a real waste of time. But they are so anxious to know it. No, it shouldn't. We don't want to waste your money like that. And once you start the treatment, again, you don't want to worry very much about that. Except for blood sugar. Blood sugar, of course, we have to check very frequently, and sometimes home monitoring at home, maybe twice a week, would be better rather than once a month. So that is an exceptional thing. In case of blood sugar, you need very tight control. But for cholesterol, other things, we can check quite. We don't want very frequent checkup. Only exception is fasting blood sugar, and better to start early. I said it's 20s and 30s. That would be, if not it's abnormal, it would be your baseline. Then you know that at that time ECG. So most of the patients, sometimes I'm telling this now, when they get chest pain, they goes to the doctor, and doctor take ECG, and ECG also shows some changes. Right now, doctor is worrying whether this ECG changes are related to the chest pain, but most of the people does have some ECG changes naturally, because just like your height and my height is different, and your color and my color is different, ECG is not also the same for 100% each and every individual. There may be subtle normal variation. So that's why I said ECG better to take say in your 20s and 30s. That will be gives you idea. Then when you carry that to the doctor, then doctor knows that this change was there even when he was small time, was childhood, and is nothing much to worry on that.
Right. Okay, superb. Thank you so much, doctor. So that I think you have answered all our questions, and there are more, but I'm cognizant of time. Thank you so much, doctor, for taking the time and for breaking things down so clearly for us. I'm sure everyone watching would have learned a lot. I most definitely have. Viewers, if you would like to consult Dr. Sampath or would like to ask him any questions directly, you can consult him via the oDoc app. Once again, thank you, Doctor. It's been a pleasure. And viewers, join us next week at 6 p.m. for a very informative session on dengue and how to protect yourself from it during these trialing times. Until then, take care and stay safe. Thank you.
Thank you very much.